Hi, it's Dr. A from Intentional Self Aesthetics in New Canaan, and today we're going to talk about Cellenis Derma PRP. And this is an amazing product that can be used as filler. And so this is really autologous, meaning from your own tissue, filler that we create from your own blood. And I'm going to show you first how we make it and what it can be used for. So this is a really amazing amazing product, and I think after you learn more about it, you will agree. So the first thing we do is we take this kit that has all the products that we need. It has everything like syringes. It has the ability for us to draw your blood, and we draw your blood and we put it in a tube such as this, right? This is a balance tube, but it's essentially the same kind of tube. We put your blood in the tube and we put it in the centrifuge. So this is a centrifuge. This is the exact one that we use here. And then we close the centrifuge and we spin it down. And once we spin it, it will separate whole blood into platelet-poor plasma, platelet-rich plasma, and red blood cells at the bottom. And then what we do is we will take the platelet-poor plasma off the top and we will put it in a warmer, which is over here, and we will turn it into something like a gel. Once we do that, that'll be heated for about 7 to 10 minutes, and then we will cool it in a cooling bath for about 4 minutes. And once that is all prepared, then we take the platelet-rich plasma, which are actual platelets, which are the cells that exist normally in your blood. You usually have between 125,000 to 150,000 platelets per ml. So it's a lot of platelets. And platelets are usually used for clotting. And they also have something called, they also secrete something called cytokines, which are cell signaling mechanisms that allow other cells to come and either do repair of tissue or also do create collagen. And so this is also a biorejuvenation technique. So if we put platelets or platelet-rich plasma someplace, then that is going to allow biorejuvenation wherever we put it. And the reason why we put it in this gel is because that gives the platelets a kind of a framework on which to sit, right? So it gives it a matrix. So we put it under the eyes, or we put it around the mouth, or we put it in the neck, in creases, in wrinkles. It will stay exactly where we put it. Sometimes if we don't put it, if we don't use a matrix or a gel, it will just go all over the place and it'll just dissolve and we won't be able to hold it in place. So this gives it the structure that we need. So this is your own tissue. It is very useful for creating new tissue, creating collagen, and building structure and improving your skin texture. It is very safe. It is low risk. There are no risk of infections or rejection or allergic reaction because this is your own tissue. And if you use sterile technique, and we do here at Intentional Self Aesthetics, we mitigate the risk for infection. We can put it in places where we don't put the synthetic hyaluronic acid filler. We can put it in under the eyes where we don't put HA filler. We can put it in small wrinkles. We can put it in the neck. We can put it in the hands, which make it very, very convenient to use. We can also put it in areas where we want just a subtle, natural volume, where we don't want just that hard structure or contour, where we would otherwise use hyaluronic acid like Restylane or Juvederm, right? So it's a good alternative, and some people prefer it actually because it is your own tissue, and some people are much more comfortable with that. How long does it last? Some people will ask. Well, it usually lasts over a year, and the good thing about it is that it improves over time. So the quality of your skin will improve over time gradually. You may need some maintenance treatments, but other than that, it's a wonderful product to use with just some touch-ups here and there. You can also use it in conjunction with other injectables as well. Obviously, you can use it if you already have HA filler. You can use it if you're doing Botox as well and other injectables. So some people also combine it with Sculptra or Radiesse and make different combinations. There's all those kinds of things out there with people who are experienced injectors. So who would be a good candidate for this? It's basically anybody who wants it. It's as long as you're a healthy person and you are and you have the ability to have your blood taken, and you don't have any blood diseases like leukemia, lymphoma, or any kind of other platelet disorders. If you do not have, if you don't have low platelets or any clotting disorders, which are rare in general. So virtually anybody can use this product, and I find that it is a wonderful product to work with. It's very easy, it's very safe, and I look forward to talking more to you about it if you come in for a consult. And if you're interested, please come and talk to me more about it. Thanks.